Hi. Because there was a little bit of confusion during the last tutorial about the cranial nerve, the seventh cranial nerve, the facial nerve, I made this mini tutorial, this mini video, in order to try to clarify how we can use the investigation of the facial nerve to differentiate between upper motor neuron and lower motor neuron lesion. As you can read, upper motor neuron lesion would be probably a stroke, we can suppose a stroke, intracranial hematoma. Lower motor neuron lesion instead is affecting the nerve, so when it's in the peripheral nervous system, or if we have a stroke within the brainstem, but for what we are concerned, just the nerve within the peripheral nervous system. And commonly, for example, the Bell's palsy. What are the symptoms that we will see? The upper motor neuron lesion will manifest as a paralysis of the inferior quadrant quarter of the face, contralateral to the lesion, because there is of course the degustation, the crossing over of the motor fibers from the cortex. And instead, the lower motor neuron lesion would be a paralysis of the lateral half of the face, ipsilateral to the lesion. This is basically what everyone knows. I'll try to explain in a few minutes why. Let's go over. Okay, so in this picture we see the face, and we can divide the face in 4 quadrants. Okay, so in upper half or lower half, and 2 lateral half, of course. What you see at the top is the cerebral cortex, and then in the middle bit, the 4 spots, yellow spots, are the nuclei of the facial nerve, one on the left, one on the right, that are basically constituted by the cell bodies of the lower motor neurons. So we have facial nuclei in the pons, and then what we will see appearing in 1 second will be the facial nerves that are actually carrying the information, the axons from the facial nuclei to the face, to the muscles of the face. Okay, so we have the upper motor neuron that is coming from the cerebral cortex and then is going down with the bilateral innervation of the 2 upper nuclei, and the contralateral innervation only of the lower nucleus. So one side of the cerebral cortex innervates bilaterally the upper part of the face, and contralaterally only the inferior half. So 3/4 of the face. Of course, we have a symmetry of this innervation. So on the other half, we have the upper motor neuron. This coming down is innervating the 3 nuclei as before, and we can complete the picture seeing the 4th quadrant being innervated. So this is a normal physiological, neurophysiological picture. Let's now see what happens if we have a lesion of the upper motor neuron. So if we have a lesion of the upper motor neuron, we will have a dysfunction of everything that was carried out, that was innervated by this. So we will have a regression, or anyway a dysfunction of those fibers, of the upper motor neuron fiber, and we will have a lack of innervation only of the contralateral inferior quarter of the face. Why? Because the upper one is innervated by the other side. In fact, as we said, the upper 2 nuclei are innervated bilaterally. So in this case, the symptom will be a motor symptoms on the inferior contralateral half of the face. Inferior contralateral quadrant of the face. Going back to the physiology, now we'll see what happens if we have a lower motor neuron lesion. In this case, so we are supposing that there is a lesion on the facial nerve, as can be the Bell's palsy. If we have a lesion on the facial nerve, we will have a lack of innervation of an entire half of the face. The motor symptoms will be then distributed in the whole upper and inferior half of the face in 2 quarters. With this thinking about the functional neuroanatomy of the cranial nerve 7, we can actually then differentiate between upper motor neuron lesion and lower motor neuron lesion when these pathological processes are involving the face, the motor innervation to the face. Thanks.